the sperm when you have a vasectomy? I'm going, well, nothing happens to it. He goes, well, where does it go if it can't get to the outside? I'm going, well, that's a good question. I said, I know what you're asking. I said, it's actually still produced, but believe it or not, the sperm are just actually reabsorbed by the body. He kind of looked at me like, that doesn't make any sense. Math guys are like, 2 and 2 is 4. Where does all this stuff go? I said, believe me, trust me here. It's reabsorbed by the body. And it's like, well, is there any like problems with them? I'm going, the only thing I've ever read is sometimes a man's cholesterol might go up a little bit. And I said, by the way, I said, it is reversible. I said, I have a niece and a nephew that are testament to that. My brother had it done and then later had it reversed, and Charlie and Colleen are successful results of that, right? So now tubal ligation, ladies, as you know, that's a little trickier to reverse, and you'll see why when we get into the structure of the uterine tube. So it's certainly a very viable way to do it. I guess I need to tell the story. My colleague Valerie Pennington's father, who's now passed away, was a urologist, and he did vasectomies as part of his position, as his job. And Valerie told me a story one time. This is why I'm not, certainly one of the reasons I'm not a doctor. Her father was sued by a man who he had performed a vasectomy on. And I know what you're thinking. It's like, yeah, he botched it or whatever, and now there's babies, right? And that wasn't what happened. And Valerie said, I swear this is true now. The guy drugged him into court claiming that as a result of the vasectomy, his penis was now shorter. I mean, that's like almost like the pituitary gland. It's like, did he have pictures? I mean, like before and after? I mean, I don't know. Well, of course, the suit didn't go anywhere, but I mean, he had to hire an attorney, and it has to have malpractice insurance and all that kind of stuff. So I'm not sure it's any connection between size and the length of the tubes. Anyway, so that's the ductus. Here's what it looks like under a microscope. You can see it's a little narrow opening, and actually, the pictures you'll see are a little different than this, but a fairly big muscular wall. But it's not very thick. It's kind of looks. I should one of these days. I'll have to ask one of our cadavers is a male. I don't know that the male reproductive system's been worked out. I should ask Tolley one of these days, John Tolley, if they've ever done anything in that area, because it kind of, the pictures I've seen of it, just kind of looks like spaghetti. I mean, it's about that thickness, so it's not, the tube is very thin. But under microsurgical procedures, they can be sewn back up. Just another picture of it. You can see the little ciliated cells and stuff like that. So that's the ductus deferens. Oh, this was somebody asked me about this one. So failure rate, 1 in 2,000, meaning pregnancy. Failure rate for tubal ligations are a little higher. Reversal success rate, very few side effects, and the sperm are just reabsorbed by the body. And if you're wondering how it's done, no, I don't have a movie, don't worry. Just kind of make a little incision in the scrotum and just kind of get a little snip. They do it under local anesthetic.
So they do tie it.
Yeah, typically tie it off.
That's what I didn't get. I thought they just snipped it and like the tube. So
I see what you're saying. Oh my gosh, yeah. Oh, that would. Yeah, maybe that's what my math roommate guy thought.
Yeah,
it's like, oh well, wait a second. Not to get gross here, but I think he had this mental picture of maybe his. Anyway, you get what I was going at. Yeah, we both know what Michael was talking about. Yeah, just.
Can't your testes like explode or something?
I'm pretty sure they can't. No.
What if you just keep on like building?
It just keeps getting reabsorbed. Well, seriously. I mean, I know it doesn't make sense, but.
Oh, by the epididymis?
Well, and just by the surrounding tissue. Yeah, I know it seems really weird, but in fact, it's true.
So the composition of sperm is high in cholesterol. That's why.
No, I don't know why that happens. Yeah, no. This is why this is my favorite lecture of the semester. Although I'm not sure People are going to wonder what kind of class she's taking here. Anyway, but this I like to tell my students all the time. As nurses and stuff like that. I mean, people know you're a nurse. They're going to ask you these questions. So hopefully you have an answer. Rather than say, I don't know, go to Google. Anyway, so that's how the whole procedure is done. Now here's a picture to So here's the bladder. Here comes one of the ductus from one side. Got a nice little, support role here for the ureters. And then there's this little, kind of expanded region here as the ductus begins to end. And here's one seminal vesicle. Here's the other. And you can see it's like a whole bunch of tubes coming together. And they form this really, really tiny little structure, very, very short little structure. Really, we don't even try to find it. It's hard to find, called the ejaculatory duct. And then it immediately sort of kind of, you see it's like a little pointy, like almost like an arrow, which kind of then comes right in and joins with the prostate gland. And then we have this structure called the prostatic urethra. Then this urogenital diaphragm, and these two little things here, which are the bulbourethral glands. So you can see all the accessory glands, and we'll get to what they do in just a moment, are all associated right together. So the seminal vesicles, 2 seminal vesicles, 1 prostate gland, and 2 bulbourethral glands. I once was at a talk when a urologist was talking about prostate cancer and the problems associated with it. He said, the prostate gland is structurally kind of in a tough position. It's not something that's easily worked on. So anyway, so obviously it's very important surgery. We have I'm sure Sharon Shapiro brought this in. She probably got this in the mail. A poster for Flomax, which is the one you always see on television. The guys who can't quit going and going and going. What happens is, for unknown reasons, sometimes the prostate gland will just enlarge. It's called benign prostatic hyperplasia. It's not cancerous, and the prostate will just enlarge and put pressure on the bladder. So you kind of feel like that urge to go all the time. But there's drugs like Flomax. They can actually shrink the size of the prostate. Sometimes, though, it could be prostate cancer. So if you have those issues, it's something to get looked at. Now, the seminal vesicles are one of the accessory glands. I need to put all this on here. There we go. This is one of the accessory glands of the male reproductive system. As you can see, the seminal vesicles actually contribute a very large percentage of the volume of semen, which we'll get to in a minute. It secretes a viscous, sort of whitish, yellowish, kind of alkaline fluid. But here's the important part. The secretions of the seminal vesicles contain a simple sugar called fructose. And we've all seen the pictures of the little sperm with the wiggly tails. The tails don't wiggle until they're mixed, until they hit the secretions of the seminal vesicles, because the sperm can now metabolize the fructose there to make ATP, which is the magic energy chemical in all cells. So the seminal vesicles are really important because the secretions of the seminal vesicles allow the sperm now to become mobile. Their little tails begin to wiggle around. They got a long trip ahead of them, perhaps, right? So they need some energy. And that's what my next one there was. They become mobile when they're mixed with this fluid. And also, I found this in the book, and I thought I'd put this in here. The seminal vesicles contain secretions called prostaglandins. You'll learn a lot about prostaglandins when you take physiology. But prostaglandins are hormone-like substances, and in this sense, they seem to aid in the dilation of the cervix because, of course, the sperm have to go through the cervical opening, up through the uterus, and then go the right direction. They got 2 ways to go, and the eggs wait somewhere maybe, or maybe not, right? Some of them go the wrong way. So when we get to the actual numbers, you go, wow, that's a lot of sperm. It only takes 1 to fertilize an egg. I agree with you, but, they got a long ways to go. It's a big trip. Right? So those are the seminal vesicles and what they do. The prostate is another one which does contribute. One more. A substantial component to semen. It's about the size of a walnut, kind of maybe about that size. Encircles the prostatic urethra as it leaves the bladder. We talked about that last night. You can see what it what the functions of the secretions are. But the last one is what I want to mention. It's called PSA, which stands for prostate-specific antigen. PSA levels are sometimes used as an indicator of prostate cancer. In some men with elevated PSA levels, that might signify a potential problem with the prostate and perhaps being in a cancerous or precancerous state. It's not a test which is always performed, however. You have to ask for it. Yes?
Is that what people that use steroids get tested for? Is that what gets monitored?
Don't know.
Prostate cancer.
Could be, but I don't know.
I think
I'll have to look it up. I don't know. But, you know, PSA levels, if they get high, you know, so I don't know. You know, if you're, I don't know how to put this. If you have a history of it or you have symptoms or something like that, you have blood drawn, you ask your doc, hey, could you put a PSA on the panel as well? And if it's high, then they might do a biopsy or further examination. But there's a bit of a controversy about this and prostate cancer. It's like, well, okay, should we test every single man for PSA when they're, say, 70 and older? And the answer is, what good is it going to do? Prostate cancer is so slow growing that you're probably going to die of something, and prostate cancer probably isn't going to be it, right? So it might identify people with prostate cancer, but not necessarily mean they're going to have a higher survival rate. So I don't know. You know, it's one of the things which may or may not be important. But anyway, it's one of the things they test for. So there's the prostate gland. It's not prostrate. That's like laying flat. Okay, prostate. And okay. Somebody again asked me about this one. So common above the age of 50. Average age of diagnosis 70. So well, I'm over this, but I'm not there. Okay. Usually very slow growing with few symptoms. The symptoms can be pain and difficulty urinating, maybe erectile dysfunction as well. ED, I just put that on there because everybody knows what ED is. It's like it's not a person's name, it's not Ed. You know. The risk factors, age, genetics, and diet, treatment, surgery, and radiation therapy. Prostate PSA screening, I don't know. You know, whether it should be routinely done or not, or even if it is routinely done. Since I am over the magic big 5-0 there, probably the last time I had blood drawn, it was probably in the panel. I didn't pay any attention to it. I remember when I got my results, I think it was on there, and it was like normal, so I'm going, I'm good. You know, I don't care if it was high. And of course, nah, never mind, I'm not going to go there. Go ahead.